involves economic consequences like extended hospital stay, hospital treatment, and 3.5% hospitalization due to adverse drug reaction results, 3 lakhs annually in US. I'm quoting here the data from US to understand what is the magnitude of adverse drug reaction, because we don't have that data, exact data in our country. Well, in case, let us see what are the different medication errors. Firstly, the result of a study published in JAMA, where it says that the error due to physicians ordering is 39 to 49%. Similarly, in case of transcription of the order, it is around 11 to 12%. And in case of administration, which is being done by the nurses, that is around 26 to 38%. And the error in case of pharmacy dispensing, it is 11 to 14%. So you can understand what is the magnitude of the harm the system is occurring due to different error in medication. Now, I am coming to the first point, that is the purpose and responsibility of the drug information pharmacist. This is one newer one here. The purpose is to provide patient care that optimizes the use of medication and promotes health, wellness, and disease prevention. Let us see what is the core responsibilities and activities to be done by the drug information pharmacist. Their primary role is to provide drug information services. They are required to give the authentic and unbiased information on drugs, dose, dosage form, dosage duration, adverse drug reaction, side effects, and all the information the drug information pharmacist should collect from the authentic sources. Here I can tell you, there is a belief amongst the general public that you can ask your internet, that will give you the data all about the drugs, but believe my friend, it is very difficult to understand from the net which one the real and authentic sources. So in case of working as a drug information pharmacist, we must have the idea about the sources, like primary sources. Say for example, one data published by a research article in a peer-reviewed review article or meta-analytical research paper, and thirdly the pharmacology in Goodman, similarly the formularies, and so on. And they are they required to supervise the pharmacy as well as the pharmacy students during their training course. They are required to participate in administrative activities with other counterparts in their healthcare setup, to develop and assist in developing drug monographs and reviews for the pharmacy and therapeutic committee. Dr. Gupta has already mentioned about the drug formulary. Here is a picture of WHO model formularies. That is also available. It's a small book where from you can get the references. There are some other formularies. Dr. Gupta has already mentioned about the National Formulary of India, and one more book like BNF, British National Formulary, is also an authentic resources. They required to write and edit of information publication, newsletter, contribute to continuous quality improvement, and they can present the activity at various forums. Well, what are the other responsibilities and activities? They should perform required to participate in pharmacy and therapeutic committee meetings, contribute to drug use management activities. Here is a very important role the pharmacist can play. For example, review. These are very important area in case of providing the authentic medicine. Then work with other faculty on drug information, attend major national pharmacy meeting, my friend. Believe me, attending different national, international meeting, you can gather your knowledge and in case of healthcare, knowledge is power. Then participate in entrepreneurial activity of the Drug and Information Center. Here is the example of the Drug Information Bulletin. Believe my friends, this has been introduced. This provision has been introduced in 2015 in pharmacy practice regulation, but Indian Pharmaceutical Association has visualized much earlier, and we have started in establishing licensed premises. But this section 5 of the pharmacy practice regulation also given them the responsibility of inspecting the premises. So let us see what is the role of pharmacy inspectors. They can inspect any premises where drugs are compounded or dispensed or submit a written report to the registrar. They can inquire whether a person who is engaged in compounding or dispensing of drug is a registered pharmacist. Here is very important role. Dr. Gupta has already mentioned that practically, physically, the presence of pharmacists in community pharmacy is not a regular feature now, but which must be ensured. And here, these two category of inspector have an important role to play to ensure the physical presence of pharmacists in the community pharmacy or hospital pharmacy, whatever, maybe the drug is being dispensed, and institute a prosecution under the order of executive committee of the state council, then exercise other power to implement this pharmacy practice regulation. And each and every pharmacy owner as well as the pharmacists are bound to allow the inspectors to inspect their premises, and any contravention of this is punishable, and with a imprisonment for up to 6 months or with a fine of which extend up to 1,000 rupees. Let us shift our focus to the drug inspectors. Well, their inspector are being appointed by the state and central government as per the Rule 21, or the Section 20 of the Drugs and Cosmetics Act, and they required to inspect the premises wherever drug is being manufactured or dispensed or stored, and submit the report and take action. They can also take samples of drugs and cosmetics from any premises and get it tested by the statutory testing laboratories and suggest action as per the drugs and cosmetics rules. And they also can search any premises where they believe that there is a violation of any provisions of the Drug and Cosmetics Act and rules. The significant role to be played in practice in summary. The firstly, to ensure physical presence of pharmacists in licensed premises, which is now a very big problem in our country. Secondly, ensure proper storage of drug, control over misuse of drug, ensuring safe, effective, and affordable medicines. So, before conclusion, I can tell you that implementation of this pharmacy practice regulation in 2015 as well as its amendment in 2020 given some strength to the pharmacy as well as reminded them if they violate any part of this pharmacy practice, they have made some punishable punishment clauses which extend up to their temporary removal to the removal of their registration from the register or maintained by the pharmacy council of the state as well as the pharmacy council of the center. And it makes another provision that is very important, that is pharmacy practitioner. Believe my friends, sometimes it is being misinterpreted as a medical practitioner. Believe my friend, you are not a medical practitioner, you can practice pharmacy. And that is why the pharmacy practice regulation already defined what is pharmacy practice. And another very important point being clarified in pharmacy practice regulation. Earlier, there is a plea that nowadays the drug is not being compounded, it is being supplied by the pharmacist, so there is no need of pharmacist. But my friend, the dispensing is being properly defined in the pharmacy practice. It is that simply handling of drug is also dispensing. Uh, and another provision has clearly said that do not engage yourself as a pharmacist in more than one setup. Like, please don't let your certificate to a shop whenever you are as a working as a teacher of a college, or the vice versa. This is an example. Please don't take it as otherwise. So, my friends, this pharmacy practice has given us a strength to work on this, and Bihar State, as well with the uh, help of Mr. Mukesh Kumar, they have thought a lot and established the pharmacy practice to a certain extent in your state, which is an example to our country. So thank you very much, and I am really thankful to seeing our senior pharmacist here, like Mr. L.K. Chaudhary, Mr. Umesh Kumar, Mr. Binod Kumar, Mr. Sandeep Rai, Dharmendra ji, and other colleagues. So thank you very much for giving me this opportunity. Thank you very much.
Thank you, Dr. Mandalji, for a nice speech. Uh, I'd like to welcome our National Vice President, uh, Sri Manjuri Garat, to joining the program. Welcome, Madam, the program.
Thank you, sir, so much. And it's going very well. Congratulations for organizing such programs. And I'm glad to see IPA Students Forum joining in. Thank you.
Yes, yes. Thank you.
Yeah.
Now I'd like to request our guest, Dr. Samir Dhingra. He is a HOD Pharmacy Practice Division in IPA HAJIPUR. And I'd like to request Dhingra sir, please deliver your speech on the subject you have already decided. Dhingra sir.
Yeah, thank you so much. Can you hear my voice?
Yes, yes.
So, good afternoon to all of you. First of all, I'm grateful to our Indian Pharmaceutical Association Central Division as well as the local state division, Bihar State, for giving me an opportunity to speak on this pertinent topic, Pharmacy Practice Regulations 2015. And at the outset, first of all, I would like to wish all the fathers here, wish you a very happy Father's Day, This
Yes,
is the day, past day when we are celebrating. It is not only about the home or family, it is about the profession also, how fatherly we are taking it to, the next stage. And when it comes to the pharmacy practice is, I hope whosoever is attending here, it is bread and butter for all of us when we speak about this particular profession. And before I start speaking about Pharmacy Practice Regulation 2015, I calculate approximately when it comes to the pharmacy practice in Indian setup in a professional way, it has completed more than 25 years. Somewhere it started in 96 or 97 from the SSOT and Mysore. And in last 26 or 27 years, what we have achieved in the form of regulation in the terms of, professional practices when we are contributing to the community, whether in the form of as a community pharmacist or as a hospital pharmacist or as a clinical pharmacist or as a drug information pharmacist, in every single aspect, whether it belongs to academic and societal needs, all those terms. When I look at back, I feel we have achieved a lot. And in fact, coming of this regulation itself, it shows how we are promoting our things in a right manner. And driving a new regulation to a country like India where the population is more than 1.4 billion, and we have so many states with so much diversity moving ahead. Every state has its own way of practicing the thing. And when it comes to the regulations, understanding those regulations, bringing it up to the grassroots level, bringing it up to the the community level, it is not an easy task. And I must congratulate the IPA Central Division as well as the Bihar State branch for putting their efforts and bringing these things to the public. Not only to the public, even to the professionals, young budding professionals. I'm seeing that number of students from different colleges, they have joined this webinar, that too on Sunday. Otherwise, it is very difficult to see the student on working days. But getting students on the weekends on Sunday, it is really something. It is very very good thing that I could understand that more than 250 students, they are participating in this particular event, that on when the day is coinciding with the Father Day as on Sunday. So now coming to the pharmacy practice regulation, a few things I would like to say. Since all states, they are working in different way, but practice of the profession is not going in the same way. It is going in different way. But few things are very very common, which I wish to particularly inform to our student community. When it comes to the Pharmacy Practice Regulation 2015, it has been implemented by the Pharmacy Council of India to regulate the pharmacy practice in India. So that thing we need to understand, particularly to the student community as well as the pharmacy professionals or the practicing pharmacists. So whatever their setup is, whether they are belonging to community, hospital, or clinical, or as a drug information pharmacist. And according to these regulations, I think my previous speakers, Mandal sir as well as Gupta sir, already mentioned that the only qualified and registered pharmacists, they are authorized to dispense the drugs. And it is strictly prohibited for pharmacy owners to rent registration certificates. And pharmacists who rent out their registration certificate without actually providing dispensing services are engaging in misconduct. And this action may result in the permanent cancellation of their registration certificate. And as already my previous speaker, Mandal sir, has stated that many times, the people, for the sake of money, sometimes they give their certificate on the rental basis to the pharma industry, and they join somewhere else. They start doing their post-graduation program, giving their certificate in their home state. So those things are not ethical practices. Student community need to understand these things. Even our practicing pharmacists, if they are renting their license, that is against the law. Then pharmacists are required to wear a clean white apron and a black badge plate clearly displaying their name and registration number during their working hours, as it is imperative that this requirement is met to ensure the safety and trust of the customer. So student pharmacists, practicing pharmacists, this is very simple thing though I have written, but wearing a apron makes a difference to the profession. You go to any other country, you go to Europe, you go to Middle East, you go to US, Canada, Australia, New Zealand, anywhere, you will see the pharmacists wearing the white apron. Then why this thing is missing in our Indian setup? Why our pharmacists, they don't feel like, wearing the white apron when they're serving to the community in the given setting? So I think these kind of things we should also meant when it comes to the global standard. Then the slide is not. Seems my laptop is hanging. Just 1 second. Then the registration certificates need to be displayed in a way that is visible to the public. So students, when we go to the pharmacy, even in Patna right now here, whenever I go to the, the pharmacy, local pharmacy, I don't see the pharmacist certificate. Many times I ask them, who's the pharmacist? Who is dispensing the drug? Sometimes I don't get the right answer for these questions from those, the pharmacists. And pharmacy should not only dispense medication, but also offer professional services such as patient counseling, reporting adverse drug reactions, participation in, the primary care activities for uncomplicated illnesses. And then to facilitate this, I feel if they have a bigger space, they must create a separate cell within their pharmacy. And pharmacists may charge consultation fee for their professional services, but that too you have to disclose that fees well prior to giving your consultation. You have to inform your patient that I will charge this fees for this consultation or for this counseling, not after the counseling. You have to disclose those things before the counseling. Then that for general public, if you encounter a situation where unqualified pharmacists are dispensing drugs instead of qualified pharmacists, you have the right to file a complaint directly with the registrar of the state or central pharmacy council. And this provision is there in accordance with Section 14B of Chapter 9 of this Pharmacy Practice Regulation 2015, which addresses violation of Section 42 of the Pharmacy Act 1948. Then coming to my topic, which I have been assigned with regard to the duties and responsibilities of clinical pharmacists. And when it comes to the duties and responsibility of clinical pharmacists in a given hospital, I will say that this particular act, I'm taking it as verbatim from the act itself, it takes every single responsibility with regard to the medication in a given clinical pharmacy setting, where the clinical pharmacists, they have their own purpose, duties, and responsibilities in a given hospital care setting. So first and foremost, pharmacists, they're supposed to provide patient care, which optimizes the use of medication and promotes health, wellness, and disease prevention in collaboration with physicians and healthcare professionals. So, my dear pharmacists, we need to understand whenever we are working in a hospital setting, it is a teamwork. We need to work in collaboration with all the other healthcare professionals who are working in the hospital setting, whether it is a doctor, nursing staff, or a lab technician, whosoever it is. Because at the end of the day, all of us, we are working for the betterment of the patient. And when it comes to the job of a clinical pharmacist, our job is to optimize the use of medication in order to promote the health as well as general well-beingness of the patient. Then at the same time, we should be also able to evaluate all Medicare coverage requirement requests. Whatever Medicare coverage requirement requests are coming in your hospital setting, though very less seen in government setting, but in good big corporate hospital now, those requests are directly coming to the clinical pharmacist. They need to pay attention. That will help a lot to serve the profession in a better way, then ensure the compliance to all clinical procedures. That is the inbuilt duty of our profession. Then coordinate with pharmacy and medical staff to perform regular intervention according to the present drugs. So whatever drugs are given in that setup, or if you need to optimize the treatment as per the given treatment chart, in that case, if you need to collaborate with the medical staff, nursing staff, all other people, in order to make any intervention in the treatment chart, we need to take that job very seriously. Then we need to perform regular evaluation on all uses and doses of drugs. Then ensure absence of all reactions. My previous speaker, Mandal sir, has already spoken about the medication safety. In terms of medication safety, pharmacovigilance, ADR, drug interaction, these are the things, creating a big problem in Indian setup. And the problem, I will say, it is going unnoticeable because we do not have data to present for that in our Indian scenario. But one thing we need to make sure after implementation of this act, many states, I think now they will start advertising the positions for the pharmacists, clinical pharmacists, drug information pharmacists. But it comes under directly domain of hospital or clinical pharmacists. They need to ensure that there is a absence of all adverse drug reactions, and whatever we are giving it to our patient, that is the best suited medication for that patient. Then assist all patients with assessment of patient orders, then assist prescription infusion and ensure adherence to all laws and regulations. That is another duty from our pharmacists, clinical pharmacists. Then gather, maintain, and analyze all laboratory data. This is a little bit personalized approach, but personalized medicine, it is taking a, coming in a bigger way now. So it is our responsibility as a clinical pharmacist. We were working in a hospital. We need to see the patient lab data, every single thing, in a personalized way, so that we can give the best treatment to the patient in terms of optimization of their treatment. Then record all required patient information. That is the inherent component. Until unless we do not record all the patient related information, it is very difficult to make or give them the tailor made information, or even the drugs also. Then make recommendation to change doses if required. Then administer and complete all pharmacy clear care plans. If you're working in a hospital setting, if you're working as a, the clinical pharmacist, it is your duty or a responsibility to formulate or design a pharmaceutical care plan. Because clinical pharmacist position, basically it is a senior position, and you have to have the expertise in rolling out the care plans or formulating the care plan for the betterment of your patients. Then perform reconciliation of all medication in the given hospital setting and supervise all sterile mixing processes. You have to have a look on every single thing what is happening in your hospital setting, what kind of medications are coming to your setup. When it go to the sterile preparation, what kind of mixing is going on, whether those are adhering to the sterile standards or not. So being a clinical pharmacist, that is another responsibility for the clinical pharmacist. Then review all medications and equipments and ensure accuracy and effective functioning. So I think that is again an inherent component. It is not only about the medications, even the equipments, medical devices. We have to ensure whatever things coming to our patient in the form of improving their therapeutic outcomes or in terms of improving their treatment outcomes, we have to have a close check on all those items. Then we need to manage all communications with physicians and patients. So we have to open the channels, in terms of communication. We have to frequently meet the physician of that clinical facility. We have to give time to our patient. If they want to discuss anything, if they want a counseling for any particular medication, if they want to hear something from you regarding any given particular drug, we need to manage all those communications. Then assist to resolve all patients within the required time frame. So we cannot keep our patient on long waiting. If the patient has to get some sort of resolution with regard to their drug, if they want to get any counseling point from your end, you have to give them within given framework, so that your trust, or the patient trust, should be increased on your functioning or the overall role of the pharmacist. Then maintain record of all medication for patients. Though I've been given just 15 minutes, so I'll just quickly go through. Okay, so maintain record of all medication for patients. Then ensure absence of all discrepancies in the given treatment, and you have to ensure that your patient is getting the one of the best treatment. Then analyze all side effects and drug injections. Then retrieve clinical information for the monitoring, whatever information you have to be aware of all those resources. Already, Dr. Mandal sir has also mentioned about the drug information resources, primary, secondary, tertiary. So you need to know, even as a clinical pharmacist, you need to know how to retrieve those information. Then revision of the medication use process. Then coordinate with all medical case managers. Then evaluate all high risk members to prevent all type of risk with your patients. Then participate in all patient associated meetings, whatever happening in that clinical facility where you're working in that hospital. You need to attend in those meetings where the patient associated things are being discussed. Then prepare all clinical documents for the other meetings. Then participate in all on call activities for the pharmacy. Then evaluate all pharmacy claim data and identify all clinical savings. That is with regard to the basically annual budget plan. You have to have a thorough checkup. You have to see the pharmacoeconomical component also, whatever drugs are coming in your clinical facility, whether they are able to provide that sort of relief to your patient, what is their successful rate, what is their efficacy and safety data saying in terms of your clinical facility. If it is proven good, you can speak to the hospital administration. If it is not good, next year you may change it. So it may be helpful. It may be helpful to your hospital administration also to save the money, at the same time ensuring the patient safety. Then attend all the therapeutic, drug monitoring committee meetings and other meetings. Then design and maintain all medication protocols for all clinical pharmacies. Then evaluate all data to administer all drug utilization patterns. Then coordinate with all clinical team members to ensure optimal services. Then provide support to all clinical programs. So these are different duties. These are basically, some component is also coming from the administrative side also. Once you're working in a hospital setting, you have to take the charge of some administrative responsibilities also in terms of drug management and helping the drug administration, the hospital administration, in terms of basically procuring the drugs and ensuring the optimal use of those drugs in the clinical setting. Then ensure compliance to all medication process. Monitor all departmental activities with regard to your clinical pharmacy setting. Then analyze all quality improvement activities. Then present all annual studies for the management. Then serve as a drug information resource. So in the hospital setting, your department can also serve as a drug information resource. If you're keeping the drug information resources like books, software like Micromedics, these kind of things, Lexicom, these kind of things can be very, very helpful for the physician also to understand to collect the unbiased information from your center. Then contribute to drug use management activities. Then work with other faculty on drug information services related projects as needed. So you may associate with the ongoing research projects also, clinical trials also, along with the other team members or doctors or the other people who are engaged in the ongoing active operational research in the given clinical setting. And coming to the next topic, which I have been tasked upon, was the pharma clinic. Is it legal? Because this is a very, very valid, I think, a question. Many times, people come forward and they ask from us also as a teacher that, sir, now in this pharmacy practice regulation 2015, later on the amendments, whatever happened, whether now we can open the clinic or not. But my dear students, if you see the PP Regulation Act 2015, it states very clearly that there is no such provision to open the pharma clinic. And under the said regulations, the registered pharmacist is required to dispense medication on the prescription of a registered medical practitioner. So students have taken this particular point as such verbatim from the our PP Regulation Act. And I think clarification has also put on the PCI website also. So it states very clearly that we are only supposed to dispense medication on the prescription of a registered medical practitioner and can counsel the patient or caregiver on medicine to enhance or optimize the drug therapy. So once you get a prescription from the registered medical practitioner, you can just counsel the patient or the caregiver of the patient. Okay. And in that also you can speak about the name and description of the drug, the dosage form, dose, route of administration, and duration of therapy, then intended use of the drug and expected action, then special directions and precaution for the drug, then common severe side effects or adverse effects or interactions and therapeutic contraindications that may be encountered, including their avoidance and the action required if they occur, then techniques for self-monitoring drug therapy, then proper storage of the drugs, then prescription refill information. So these are the components where pharmacists can speak to the patient when it comes to the counseling. And student, if you see any error in the prescription still, in that case, you're supposed to speak to the concerned physician or concerned registered medical practitioner. And if you have any better drug to suggest, even in that case also, you need to speak to the concerned registered medical practitioner. As such, pharmacists, they are not supposed to run any pharma clinic. So I think that's all from my side. Thank you. Thank you so much for giving me the time. So I hope I could finish it within the given timeline. Thank you.
Thank you, Dhingra Sahab. Actually, 15 minutes is not sufficient to any speaker to cover their respective areas, but you have covered nicely and in a very nice way for the listeners. Now I request Manjuri Garu Madam, please say a few lines on the topics when you are present. I cannot, I must request you to speak on something as you like on the matter. Madam, hello. Hello. Hello.
Ma'am has left. Probably ma'am has left.
She left just now. She left just now.
Oh, okay. Hello.
Dada.
Yes, please. Yes, please.
I'd like to request Mr. Mukesh Kumar to share and what is the difficulties he's still facing in implementing PPR 15 in Bihar. Mukesh ji. Hello. Mukesh ji. Hello.
Yes, sir.
Mukesh ji. Hello.
Hello.
मुकेश जी,
Yes, sir.
मुकेश जी सुन रहे हैं?
हाँ सर, हाँ सुन रहे हैं सर। आवाज आ रही है?
हाँ आवाज आ रही है।
हाँ, नहीं हम तो फेस कर रहे हैं कि एक्ट रेगुलेशन जो भी है हम लोग इम्प्लीमेंट ही नहीं कर पाते। इवन SLP वर्डिक्ट के बाद भी हमको परेशानी आ रही है। इवन हाई कोर्ट की मॉनिटरिंग के बाद भी ये परेशानी आ रही है। इस पर भी थोड़े कुछ इनलाइटमेंट होना चाहिए था। इस पर थोड़े प्रकाशित करें, कैसे इम्प्लीमेंट करें इसको।
Oh. Actually, Gupta sir, hello.
हाँ, इवन एसएलपी वर्डिक्ट के बाद भी
Actually,
और ये
problem
इम्प्लीमेंट
is
नहीं हो रहा है। और इसमें पीसीआई का भी कुछ उतना जितना मार्गदर्शन होना चाहिए, जितना कोऑपरेशन होना चाहिए था, उतना हो नहीं पा रहा है। जबकि हम तो ये पीसीआई का ही
state government is delaying
इम्प्लीमेंट कर रहे हैं।
the process.
Yes, sir.
Hello.
Yes, sir.
Gupta ji. लगता है कि लिंक है। अच्छा, any question from anybody? Any question?
Hello. Yes, I have a question, which is probably similar to Mukesh. As we know that the Bihar government has notified that the PPR is amendment in Bihar, but till date, no rule and regulation will be changed on the base of the PPR. So what we do to implementation of the SLP and PPR rule in Bihar?
गुप्ता जी कुछ सजेशन दीजिए।
एसएलपी मीन्स आप स्टेट लाइसेंसिंग अथॉरिटी क्या बोल रहे हैं? एसएलए
नहीं सुप्रीम कोर्ट
SLP
सुप्रीम कोर्ट वर्डिक्ट है।
सुप्रीम कोर्ट वर्डिक्ट government agreed notification released but actually not implemented in the ground. लिंक का ऐसा हो रहा है।
No. Implementation, actually we have to do practice. That is the main implementation. We have to do right practice. All pharmacies should go through this content of this PPR and they have to do practice. That is the main practice. Government, no need of, it is already notified by the Bihar government. It is all right. Now it is up to us to take up the matter. If you do not do, then it will remain as such.
But sir, there is a problem when a pharmacist open a pharmacy with the name of just like Jai Mata Di Pharma Clinic. The government of Bihar, the state government and the drug department taking immediate action on him that you cannot open the pharma clinic on the name of clinic. You open just like a medical and what?
No, clinic means where
name your clinic.
No, that is better, no? We cannot put the name clinic. It is our pharmacy practice. You will write, it is a pharmacy where you will put pharmacist is doing practice. We are providing professional pharmacy services. We cannot write clinic. Clinic means doctor is prescribing medicine. We are not the doctor, no? How we can do practice of medicine? We are doing practice of pharmacy, not the practice of medicine. We know in village so many clinics are there without quack. LMP, RMP, there we are not the quack, no? We have to provide our services. We have got our expertise. We will give that expertise. What we know, that we will sell. Okay. If advocate will do the practice of medicine, he will be survived. We will do service of our drug. We will provide pharmacy services to the patient. Like that we will do, na? Clinic is not our job.
No, I'm not saying that we are doing clinical practice. Question is that when a pharmacist going to open a medical shop and he named the medical shop with the tag attaching the pharma clinic, the drug department take immediate action that you cannot open a pharmacy with the name of pharma clinic.
No,
I think
clinic what we will not put. Now we will put the name pharmacy. You put name pharmacy, nobody will object. But if you will keep drug, then automatic drug license is to be taken. We have to abide by all drugs and rules and regulation. Huh? We have to follow all drugs, rules and regulation. Even a medicine doctor doing practice, he has to follow his ethics, he has to follow all the regulation. Like that. We cannot ignore all rules and regulation.
Actually, Dr. Subhash Mandal, sir, I request you, please clear this. And then, Dhingra, sir. So, Mandal, sir.
Yes. The question put up by my friend Raj, you have already listened the lecture of Dr. Dhingra as well as mine, that there is no such provision of opening a clinic in the pharmacy practice regulation. The provision is there, that is you could be a pharmacy practitioner. So that provision is not there, firstly. Secondly, it gives a wrong impression amongst the people that we are doing clinical practice, means like doctors. So they might not allow you to open the clinic. That is our interpretation, because that provision is not named, and you can write that pharmacy practice is doing here, and you can mention what is your fees for giving the pharmacy consultation or pharmacy practice. So that is the right way. And one more question has already come, that it is not really implemented, my friend, as far as I know. And if the pharmacy practice regulation has been notified, it is to pursue the authority, whatever we are willing to place our views and discuss with them. Secondly, let us practice, let us follow our duty, whatever there within the pharmacy practice regulation. So I think I am able to clarify our views. So thank you very much.
Bandyopadhyay sir, Dhingra sir wants to say something. He has raised his hand.
Hello.
Yes, sir. Please.
Yeah, Arjesh, when it comes to your question, I agree with you. Many times, the rules and regulations are, formulated. And when it comes to the implementation, ground realities are altogether different. Many times it becomes very difficult for we people to convince our own people that you're doing wrong thing. And this is a newly constituted act. And if you listen to your village level, it becomes very difficult. Only two things I can suggest to you at this point of time. First thing, we need to create awareness. We need to organize more and more these type of events to make people realize what you're doing, that is not the right thing. You may earn the money, but at the end of the day, you may not get the satisfaction later on down the years of your life. Money is not everything by doing wrong practices. That is, we have to touch their consciousness. We have to bring awareness at that level, that you need to understand. At every place, we cannot go with the stick, no. That, even sometime I feel our state systems got paralyzed when they get the support from the, many of the parties, I will say, I will not directly involve it here, but many times they get the support from the people, but support they are not supposed to get. So we need to create awareness among our people. Second thing, we need to take all stakeholders with us together: drug regulatory authorities, lecturers, state pharmacy council, governing bodies like IPA, many, these type of people. All stakeholders need to work together to ensure that we can improve the practices in the state or at, these level. So these are the two things at this point of time I can say. Other than, it is very difficult to convince. Sometimes few people, they will always break the rule. Even they understand. If you will go to them, you will tell them, said that, see sir, this is the PPR. It has been implemented. It has been enforced by now. The Supreme Court ruling has also come. The state government has also adopted. Patna High Court has said also and so thing. But they will say, no, I don't want to listen. Who are you to tell me? Many times people, they become too much offensive. They are not willing to listen to anybody. So, but that does not mean that we should stop our good practices. You're getting my point. The day will come when the
Yes.
majority will be on one side, very few wrong people will be on the other side. If not today, somebody, maybe tomorrow, their son or their daughter may stop them. That, Papa, you are doing this thing for last 20 years wrong. This is not a healthy practice. I didn't read anywhere. You're getting my point. So,
Yes,
but
sir.
for one or two people who are breaking the rules, we cannot stop the good practices. We have to carry forward.
Ac-
We have to take it
Actually,
forward. If we
actually,
have to become a forwarding, society, and of course we are a part of forwarding
actually,
society. We are not going a part of, a moving back society or going backward society. No.
actually, sir, my question is not that the pharmacists are doing the clinical practice. My question is that is we name is we name our pharmacy name with pharma clinic or not? This
I
simply
think
question. We are
Gupta
not.
sir and Mandal sir has stated very clearly use of the term clinic. Gupta sir has also very stated clearly. Mandal sir has also stated very clearly. We are not supposed to use the term clinic. If somebody is doing it, they are going
Yeah,
against
that
the
that
the
was the
rule.
my query, sir. Only
So,
term, not.
and if we are able to convince them, it's okay. If they're not getting convinced, then it is a problem. Then sometimes become problem for us also. Many times people, they do not listen also. If you go and tell them, sir, you're not doing the right thing by putting the name clinic, they will say,
Actually,
who are
sir,
you to ask me?
majority of pharmacists are confusing with the term pharma clinic. He is using term pharma clinic, and when the term pharma clinic come, then
Rajesh, they are
that's
not
why I'm
there. If you
querying it.
ask me, I met few people here, in Patna. They are not confused. They are convinced, but they are convinced in other way because they are earning money by using that name. You are getting my point. When you put the
Yes,
clinic word, patient get confused that some doctor is giving the services inside, some doctor is providing services. But the fact is,
yes,
once you
yes,
enter into that shop or that clinic or pharma clinic, you won't see a doctor there. The person who is sitting there, whether he is a pharmacist or not, that is again a doubt.
yes.
Many times, but they are doing it in a wrong way, though many of them, they know very clearly. And if you go and tell them this is against the rule, this is against the PPR, still they are not willing to listen because they want to mint money by using that
Yes, yes.
title clinic. That is the problem.
Ayush has a question. Ayush, what is your question? Ayush, Ayush, what is your question? Ayush, I, hello,
Yes,
Dr. Mandal, I have a question for you, sir. Dr. Mandal,
yes, please.
now
Yes, please.
one is pharmacy inspector and other is drug inspector. And that means there is a double inspection in a premises. How much is this workable? Whether pharmacy inspector has the right to inspect as per Drug and Cosmetic Act or not?
Yes, yes. This is a time of confusion among some people, but it is very clearly said that pharmacy inspector will follow the Pharmacy Act and the Pharmacy Practice Regulation, especially for pharmacy practice. And the role of drug inspectors is different. they can punish a particular, violation as per the drugs and cosmetics rule. That both are different. Those are not single one. Their purpose, drug inspector have their purpose to ensure the safe quality dispensing of safe quality medicine to the people through the pharmacist. And the responsibility of pharmacy practitioner, pharmacy inspectors, is also the same, but to implement the Pharmacy Act. And the two authorities different. Pharmacy inspector will take action through the pharmacy council, and in case of drug inspector, the drug control authority will take the responsibility.
Yo.
So here is a little confusion, but it is not too much.
Yo. I think anybody have any other
Sir,
question?
I have a only minute doubt. Yes, I have a minute doubt. Just like drug inspector is appointing authority as a state government or a central government. Then who is the authority to appoint this pharmacy inspector? Either a state council or a state government.
Yes, state council can appoint with the prior approval of the state government. Similarly, Pharmacy Council of India can appoint with the prior permission from the central government. It is mandatory to get the approval from respective government. That is important.
Sir,
Otherwise, they cannot appoint.
out of the box, I have one doubt. Actually, I'm the member of a state pharmacy council, elected member of a state pharmacy council, Bihar. I have a doubt that if government is unable to give or appoint the nominated member, is that a state government? Is that a state council will be formed or not?
Pardon?
Okay.
Please repeat
Actually,
your question.
sir, if a state government is unable to appoint the nominated member in a state council, in this situation, is a elected member can form the council or not?
Actually, question,
Well, this is
sir, matter is actually, sir, 1 minute. Actually, 6 members are elected by election among the pharmacists. Then 5 members to be nominated by the state government and other ex-officio members, and total number is 17 or 18. What is the situation now?
15.
15. 6 members have already elected, but government has not nominated the 5 members, and so council is not functioning. Actually, then what step you suggest in this situation?
well, this is a point of legal point, and as far my knowledge goes, the entire council must be there. The similar situation is there in West Bengal, where only members are there, but there is no elected member, and government nominated members are running the council. So there are 2-3 cases in the High Court is pending, whether they are allowed to continue the service of the pharmacy council. So it is a legal question and it is under court. If you can get a clarification, you have to go to the court of law.
सतीश जी, हेलो।
हाँ सर।
कुछ क्वेश्चन आ रहा है, देखिए ना, उसका टैकल कीजिए ना। कुछ क्वेश्चंस होगा, हम फ्लैश देख रहे हैं, हम आइडेंटिफाई नहीं कर पा रहे।
नो सर, कोई हैंड रेज तो नहीं है बचा हुआ?
हैंड नहीं, मुझे लगता है कि आउटसाइड। ओके, आई थिंक कोई है? Please answer this question. What is your question?
The answer is already been elaborated by Mandal sir.
Yeah.
That it's a legal issue.
I think we are the end of our webinar. Now request Dr. L.K. Chaudhary, very senior member of IPA Bihar and past president. Please, Chaudhary ji, please say a few words. Dr. L.K. Chaudhary. Dr. L.K. Chaudhary. L.K. Chaudhary. अनम्यूट कीजिए चौधरी जी, अनम्यूट कीजिए चौधरी जी, अनम्यूट कीजिए। ओहो, चौधरी जी।
हेलो,
आई थिंक हाँ हाँ आवाज जा रही है, बोलिए बोलिए।
Firstly, I thank to Dr. Subhash Mandal, who has participated in this webinar and given a good speech on the issue which was given to him. And secondly, Dr. R.N. Gupta, he has also beautifully said about the Pharmacy Act. And Mr. Samir Dhingra, I never met him, but today I have seen him. I thank to him. We, the association, and all members of the association who have participated in the webinar. Thanks to everybody. Hello? Hello? Hello?
Yes,
Yes, yes, सुन रहे
I cannot
सुन
forget
रहे।
to give thanks
We can
to,
hear you. सुन रहे हैं sir.
I cannot forget to give thanks to our secretary, Mr. Robin Bandyopadhyay, who has organized all these things, and all, Satish ji and Mukesh ji, Rajesh. I give thanks to all. Thank you.
I think today we have all enjoyed a very nice interaction. Everybody in a very short period of time expressed their views on specific areas of the PPR 15. And I think various confusions must be clear. And therefore, at the end, I once again thank you, all of you, to join today's webinar. Okay, thank you all. So,
Thank you, sir.
Thank you.
thank you.
Thank you.
क्या चले?
Thank you, everybody.
जी,
Thank you. Thank you.
Thank you, Chaudhary. Thank you. Dr.
Thank you,
Sunil,
sir.
Dr.
Thank you.
Mandal,
Thank you for the giving of.
Ravindra ji, Mukesh ji, Vinod ji, namaskar.
Thank you very
Vinod ji.
Thank you very much.
Vinod ji. Vinod ji.
thank you.
Vinod ji,
Namaskar.
thank you.
Okay, thank you.
Thank you, sir.
अभी कहाँ हैं गुप्ता साहब?
अभी बंगलोर में हैं। आपकी तरफ हम भी घूम रहे हैं।
हाँ, अभी हम परसों ही पटना आए हैं, परसों आए हैं यहाँ।
हाँ, बढ़िया हुआ, सेमिनार के लिए आ गए थे। आपका सक्सेसफुल सेमिनार।
चलिए फिर बात करेंगे। ठीक।
हाँ ठीक, आएंगे बात में। ओके, थैंक यू एवरीबॉडी। सतीश जी, थैंक यू।
Thank you very much, sir.
Okay,
बहुत दिन बाद फिर आएंगे, पटना मिलेंगे आपसे।
Yes, sir. Yes, sir. Most welcome, sir.
सतीश जी महान व्यक्ति हैं हमारा।
Thank you.
ठीक है
sir.
साहब, अब पटना आए हुए हैं।
हाँ सर।
मुकेश जी।
जी, थैंक यू सर, प्रणाम।
खुश रही। तो आप कभी मिलिए यहाँ, हमें कंकड़बाग रोड पे ही तो मेन रोड पे हैं।
जी जी, आएंगे आएंगे।
हाँ, नंदन टावर। आप पूछ लीजिए फोन नंबर, मिलेंगे। थोड़ा आप हमको चलने फिरने में दिक्कत होती है ना।
जी जी।
और
हम आएंगे, आप कहाँ आएंगे?
नहीं वो तो नहीं वो आते हैं, जरूर आएंगे। चलिए, तो आप भी सतीश जी फिर मिलेंगे हम लोग। ठीक है।
सर थैंक यू सर।
थैंक यू।